Welcome to the special education second class. You can study via YouTube sessions. So my name is Dampriya Gunawardana. This 100% free of charge certificate course, including 12 YouTube sessions. So you can study and complete the course via YouTube. And finally, you can do the exam, and after the completion of exam, you can get a online certificate also. So last time I have discussed what is special education and special education needs mean. I discussed last first class. And also I mentioned development, learning, physical and sensory, main key areas of the special education. And also I mentioned this short course, we expect to discuss autism to visual impairment. Normally, we can divide these main areas into 15 categories. 15 categories. So normally in special education, you need to learn these all 15 categories. Uh, at least you have to get basic knowledge. Sometime you are a mother of special child. Sometime you are a teacher. It's a no problem. You need to learn these areas, at least basic knowledge in here. Yeah, you can decide. You can learn more and more and get good knowledge about these areas. Also, last time we discussed what is autism. Normally, we are discussing autism spectrum disorder. We can basically identify them as communication delays, social skills delays, and behavior issues. Last time, I showed you a video also, small video, and we discussed about these things. Now, today, second class, I like to discuss the main three levels of autism. Level 1, level 2, and level 3. Depending on how incompatible their autistic traits, normally we can identify them as a level 1, level 2, or level 3. Now I would like to discuss this level 1. Level 1 normally we called, normally we can uh, mild autism level. We can call as mild autism. Mild autism means autism traits and needs lower level. Lower level, lower level autistic people often do, other than other two levels. So autism children or people, they have low support needs, still have a hard time communicating and interacting with others. So the same as we discussed earlier, communications and social skills, behavior issue, uh, they have, but not the high level, very low level, mild autism. So basically, this type of kids we can develop easily. We can identify them normally in 2 to 3 years of age. So we can develop a good plan, and they can develop very easily to minimize these difficulties. Autism level 1. Then autism level 2. Autism level 2, now this level higher than the level 1. Communication, social skills, and behavior issues. Normally, now the level 2 become little bit hard. Repetitive behaviors, to narrow special interests. Normally, these type of children a little bit difficult to handle. So sometime we need to get doctor advice. Sometime we need to uh, SLT, speech language therapy supports. Sometimes occupational therapy supports, physiotherapy supports. Normally, level 2, we need to give more concentration to develop. Level 2. Then level 3. Level 3, you can see this slide. Level 3, severe. 1, 2, 3. 3 means level 3 autism will be hard to develop and hard to uh, work with them, because these all challenges are very severe. Normally, non-verbal, verbal communication, sometimes they are doing very uh, unbelievable things. We can manage very difficult thing. So this is the level 3. Level 3, we should get doctor's advice and other support. Sometimes doctor prefer some various things to do, and sometimes drugs needs some levels of drugs need to use. So this level 3 is the hardest uh, type of the autism levels. Type of autism also earlier. Normally, in last 10 years of time, we are discussing these 5 categories: PDD, AD, AS, CDD, RS. Now, we can also ASD. We can discuss this all 5 areas in one, get a one category and discuss the as ASD level. So now it's easy to understand and get knowledge about ASD. Earlier, we separate levels PDD, AD, AS, CDD, RS. Like we have to learn every types, every levels. Now it's little bit easier to teachers, parents. They can understand little bit easier than earlier, ASD. So today also I am ready to share with a small video. Small video you can see and listen. So we can see this small video, right? We can see.
Their minds work in very similar ways. One or two, however, have minds that are atypical in a particular way. They could be diagnosed with autism. This happens to boys 4 times as much, perhaps because diagnosing them is easier.
Boys easier diagnosed, no?
Children and adults who are considered autistic experience the world differently because they were born with various degrees of neuroatypical traits. Most autistic children have more
Difficult thing.
refined senses and share a deep desire to bring logic into their surroundings. Some seek repetitive behaviors that follow specific patterns, and many appear to be asocial and avoid eye contact. Autism is not a disease and therefore cannot be
Autism
cured.
is not a disease, and
Since
also its
all our
mission
brains are
cannot
different
be
and there is an
cured, but
endless range
we
of
can
nuances in
develop
their
them, we can
architecture,
minimize
autism
their
is defined as a
difficulties.
spectrum. On one side of the spectrum is high-functioning autism, also known as
High
Asperger's
function.
syndrome. These children are highly intelligent and have extreme abilities and
It's the
interest in
positive side of
specific areas. In the middle are those with average intelligence and some problems learning new things in school.
Some
On
are
the far end of the spectrum are
generally
children with
high, some are
severe learning
average, some are
disabilities who may
very
require
low.
support in their daily lives. Timo, a young boy, can help.
Right. Now, I would like to discuss very important things: sound sensitivity and autism. Normally, when we are working with autism kid, we can see sound sensitivity, how to affect researchers way they introduce very uh, good ideas, good learnings. We have to uh, give our attention. High and intensive noises can have severe impact on people living with autism. Sound. Normally, I think you all know in human, as a human, uh, 20 hertz to 20,000 hertz is our normal hearing levels. But in this situation is different. You can read this slide. So normally some noise very painful for this type of children, especially autism children, because their hearing level hertz 20 to 20,000 is different than normal people. So this is a very important thing as a parent, as a teacher, you have to identify. 65% autism individuals demonstrate sensitivity to sounds. Behavior differences related to how they respond to sensory input. Sometimes these responses, they are uh, totally out of the their situation, and they are facing lot of big issues, painful and uncomfortable. So we have to learn very carefully, and when we acting as a parent or teacher, we need to give attention to this voice and this sensitive problem. Now I would like to attend your uh, special voice recording, right? This wave sound hertz 8,000. Normally, we measure sounds, hertz, and decibel. I think you all know about that. Hertz and decibel. Here, decibel 8,000, right? 8,000 wave. Normally, 8,000 wave can hear every one of us. Now, I'd like to play this wave. Carefully listen. Carefully listen. 8,000 hertz. You can hear now? Right, you can hear 8,000. Now, here, 17,400 hertz. Sounds only kids can hear. Why? Why? This therapy says that adults above the age of 25 cannot hear a sound called this mosquito tone. We call this 17400 hertz wave as a mosquito tone, like a like a mosquito tone, right? Right. This is the thing we have to learn. Earlier, 8000 hertz wave, we all hear. We all hear. No problem. Child can hear, you can hear. Sometime any of age people can hear 8000 hertz. Now it's increase up to 17,400. What will happen? Below 25, age of 25, they can hear this wave, but others can't hear. Now I play. You can try. If you are age of above 25, you can't hear this wave, right? If you are below 25, you can hear, right? Try. We will try. Now, okay. Now I play. Now playing. Can you hear? Can you hear? Here? Right. Now I stop it. 8,000 all can hear. 17,400 all can't hear. Right? Then when we do various type of researches, we can see some sounds waves, especially breathing. Sometime uh, when a child in school, teacher talking, and sometimes vehicle horns, sometimes train going. Do you believe? Do you believe these old sounds can hear these autism children? Can? Can? No. Normally, this I mentioned here 17,400, 8,000, and earlier I mentioned these things, sound sensitivity. Some noises they can't hear, some noises they can hear, but we can't hear that noises. And sometimes train is going away from the school. Teacher can't hear, or teacher not giving attention to the train sounds also. But this sometimes this autism kid, he can hear loudly. Why? His sensitivity, his hearing sensitivity is different than normal children and normal people. So when we are working with people with autism, we need to very clearly give attention this situation. So today I've discussed autism and autism level 3, and finally I discussed the sound sensitivity. Any questions you can ask now? Also, some students are studying via YouTube, so you can send me questions via message, WhatsApp, or email, so I can reply you personally, right? So now I would like to give you attention for the next class and class 3 and further on autism and sound sensitivity lessons. You know, all of we have 8 senses, no? Yes, we have 8 senses. Here 5 senses, no? 5 senses, no? But we have 8 senses, no? We have 8 senses. External 5 and internal 3, right? When we are focusing in this special education subject, we have to learn more about these internal senses. I have 20 years of experience in this field, so I have done a lot of new things, researchers, work with children, teachers, and trained teachers. So I have a lot of experience and new things, new initiatives also. So I'm happy to introduce you vestibular sense activities, interoception, proprioceptions activities, and we can develop autism children. Earlier I mentioned level 1, level 2, and level 3 autism levels. These all three areas children, we can gradually develop to using, to focusing these senses also, right? So third class, I would like to discuss further about these subjects. So I would like to invite all you to participate and join third class. And if you need to participate for the third class, so you have to send me a message. Then I will send you a YouTube link, right? So thank you very much. All the best. We will see you in the next third class. Okay. Bye-bye, all of you. See you next class.